Greetings, colleagues, Board of Trustees, Dr. Church, faculty, staff, family, and friends. Wow, what a journey. 4 years for some, 5 for most, 6 or maybe 7 for a few who really like school. At first, it felt like we would never see that light at the end of the tunnel, and now here it is. One adventure ends, and another begins. We've all heard things like, "You're doing what? Naturopathy? Is that like homeopathy?" Can you prescribe drugs? Can you make any money? Will you get arrested? After trying to explain the philosophy and practice of naturopathy and convince people it's as real as conventional medicine, we may have heard, "Oh, so it's hippie medicine with herbs and stuff? Is it kind of like a glorified health coach?" That's the way much of society perceives us. But there's a paradigm shift in both medicine and society, and we are at the forefront. I'd like to share and sum up what it was like for us the last few years. Year 1, survival. Family and friends, you may remember this time. We seemed to drop off the face of the earth for a while, and you wondered, are they alive? 24 to 29 credits every quarter, 11 to 13 classes, and just trying to memorize all the enzymes, cofactors, cycles, bones, nerves, muscles, ligaments, tendons, blood vessels, and naturopathic philosophy we could. I still don't know how the toilet works. Just kidding, Dr. Mondell. I know how the toilet works. You just pull that little handle, right? Year 2. Okay, now we're out of gross anatomy and cadaver lab. No more memorizing biochemical pathways, but still rolling with 24 to 29 credits. And we're going to start applying all this, right? Wrong. More basic sciences, more philosophy, finally some classes on treating people. Still leaving us wondering, when are we going to use all this information we've been cramming into our brains? We might lose it all before we touch a real patient. Someone other than our classmates and medical models. The year ends with basic science board examinations, and will we make it to year 3? Year 3. Nervously seeing patients and trying to fit the pieces of the puzzle together and wrap our brains around the fact that patients don't tell their stories as succinctly as the medical models. And pathophysiology doesn't always present like Dr. Frederickson's lectures. Year 4. Fighting burnout, staying motivated, trying to stay awake, building confidence, maybe even no longer defending our medicine to others but believing in it. We're starting to see that light at the end of the tunnel. You blink a few times and it's here. Let me tell you why I, and I think the majority of my fellow graduates as well, love naturopathic medicine, and why our patients love it so much too. There were times I felt inferior to our conventional brethren. Not anymore. The fact is, they need us as much as we need them. I spent over 200 hours precepting with conventional providers from emergency medicine to podiatry. They all stated more or less the same thing. Patients don't want a 10-minute visit and a prescription. They want more. They are entitled to more, and NDs give them more. The medical professions are licensed mostly by specialty: orthopedics, sports medicine, physical therapy, chiropractic, gynecology, neurology, etc. This compartmentalization or over-specialization of medicine, although necessary at times, has taken us away from our roots. Hippocrates said, it is more important to know what sort of person has a disease than to know what sort of disease a person has. In my opinion, this is where naturopathy flourishes. Our greatest strength lies in the principle of tolle totem, treat the whole person. Our training in basic medical sciences, clinical and diagnostic skills, botanical and physical medicine, homeopathy, counseling, pharmacology, diet and therapy provides us with the tools to accomplish this by providing optimal care. If I had to choose 2 words to describe members of this profession, they would be passion and compassion. Passion for medicine and compassion for patients. Although there were many joys during our Bastyr years, there were also some sorrows. I would like to take a moment to remember a few kind, dedicated, and loving souls that were lost during our time together. Autumn Sampson, Joe Sayo, David McLeod, and Dr. Bill Mitchell. For many of us, thinking about them and their fervor for life helped us through some tough times. If we're very lucky, each of us can look to at least one person in our life for inspiration and motivation whenever there's a bump in the road. For me, that person was my late father, Rick Warren. I would like to dedicate my degree to him for teaching me by example to appreciate more of what I have and to worry less about what I don't. Okay, let's get to some happy matters. First, I want to recognize those students receiving the Doctorate of Acupuncture and Oriental Medicine degree. This degree, with its focus on cancer care and pain management, is the first of its kind in the U.S. The recipients deserve an honorable mention for their hard work and diligence in this intense field of study. And now to the acknowledgments. Lots of them, so please bear with me. We would not be here today were it not for these dedicated individuals. Our instructors, whose high standards push us to be our best and brightest, to be leaders in our field. Our clinical professors, for encouraging us and constantly reminding us that even if we are pariahs to many, our medicine does work. The doctors and professors who forego the financial rewards of private practice, that teach a class or 2, or 3, or 5 for Drs. Lambton, Anderson, Yarnell, Lichtenstein, or Hobson, and throw in some clinic shifts to boot. I'd like to mention more doctors by name, but we'd be here all day. They are the ones who exude the utmost modesty and humility while continually imparting knowledge, experience, and expertise for the betterment of us and naturopathic medicine. There's sometimes quick, dry-wit compliments their veracity when it comes to garnering as much information as possible from a patient's history and physical exam. I'm sure my cohorts would agree that if we become half the diagnosticians as they are, we will be able to help just about every patient we see. I would also like to thank our knowledgeable and helpful librarians, financial aid, department registrar. Their assistance and guidance made the challenges of navigating the matrices of our respective programs a bit easier. To Claudia Starkey, magic does happen. I must thank the patients for entrusting us with their health care. This is a high honor and a deep responsibility. The more I reflect upon this, the more I realize our patients are our greatest teachers. It is the people we encounter every day at the clinic or at one of the external sites who made us strive to learn more, to do better. And finally, to my classmates, thank you for the jovial competition, the hugging, the cheering, the consoling, and the camaraderie that will stay with me for life. I thought about transferring my second year, but thanks to many of you, I decided to stay. And I can honestly say I'm glad I did. All too often in life, I think we ask the wrong questions. It's not what do we want from life, but what does life want from us? Many of us took a circuitous route to what some feel is a wacky form of medicine, and ultimately chose this unconventional path for a multitude of reasons. Our common denominator is a desire to heal people whenever and wherever we can, one at a time. Maybe we can't save the world, but we can aspire to it. As the august Dr. Seuss so eloquently said, you have brains in your head, you have feet in your shoes. You can steer yourself in any direction you choose. You're on your own and you know what you know, and you are the one who decide where to go. Thank you.